Harvard, UC Davis, Succeed, Department of Surgery Faculty Development, UC Davis Success, faculty development program. This is a great didactic session, and we have, for the course of the year, have a series of great speakers. This is the third session. The first was Dr. Farmer looking at personal finances. That unfortunately was not recorded. And Dr. Farmer had some personal stories, anecdotes that we thought, well, maybe we should release that, release these stories onto the world. The second was myself and Dr. Misty Don Humphreys on the importance and advantages of participating in the surgical specialty society, and that is available on our YouTube channel. What I would like to do now is present Dr. Piri Ackerman-Barger. Dr. Barger is assistant clinical professor and co-director for the Interprofessional Teaching Scholars Program. She is a professor at the Betty Ivy Moore School of Nursing, and teaches instructional methodology, health sciences, social determinants of health, collaborative practice, and organizational change. As the co-director of the ICS program, she provides faculty development on topics related to pedagogy, professional education, and educational activities. Her academic interests relate to health equity and social justice. She has a particular interest in preparing nurse leaders and nurse educators for diversity and inclusion in academic and healthcare settings. She conducts research and serves as a national consultant, speaker, and strategy to help underserved and underrepresented groups in health professions thrive academically. Dr. Ackerman-Barger earned her Bachelor of Science in Nursing from Humboldt State and earned a Master's of Science in Nursing Education from Cal State University of Sacramento, and a Doctor of Philosophy in Nursing Education from the University of Northern Colorado. She has published in Academic Medicine, Journal of Nursing Education, Journal of Theory, Construction, and Testing, Journal of Best Practices, Health Professions Diversity, and Journal of Cultural Diversity, and Journal of Nursing. So it's my pleasure to introduce you to Dr. Ackerman-Barger.
Thank you so much, Dr. Cook. Hi, I'm so happy to be here with you today. Couple of things. I just wanted to tell you why I do this research. And I would say just as simply as possible to promote health equity. And one of the ways that we can promote health equity is by diversifying the healthcare workforce. And so when we look at diversifying the healthcare workforce, how can we do that? What are some of the things that serve as barriers for students in our programs? And one of the things that we realized is that sometimes the climate, the learning climate, can be a barrier. Sometimes we have students that leave our programs, or we have students that do something that I call cognitive attrition, which is where they realize that the environment is not nearly as inclusive as they thought or hoped it would be, and kind of put their hoodies up and survive our programs. And I think that when you're busy surviving a program, you're not focused as much on thriving in the program. So I want to figure out ways to help students meet their full academic potential. So as we're talking about some of this data, I want you to know that that some of it can be emotionally overwhelming. I sometimes have people in tears afterward. And so what I wanted to try was entering this topic with intention. And really the reason I do this research, besides promoting health equity, is because I have hope. I have hope that we as academic learning centers can do better, and that we as healthcare providers can do better. So as I'm sharing this data with you, I want you to think about, you're gonna probably automatically go to a place where you think about microaggressions that you've received, and that's fine and good. I also want you to think about the times when you have been the source of the microaggression. And I don't know if you're like me, but I really like to repress those and forget about them and pretend that I have never participated in that. But the reality is that oftentimes we're dropping microaggressions and don't even realize it because it's related to our unconscious bias. So when you think about some of the microaggressions, also think about how when you have been the source of the microaggression, how can you hear feedback? What would somebody need to do, the recipient or the bystander, to help you hear that? The other role I want you to think about is the role of the bystander, which may be the most powerful role, right? Because the two people that are engaged in this interaction are probably going to go into defensive mode. And when you're in defensive mode, your prefrontal cortex is not as engaged and you're not making the best decision. So the bystander, I don't know if you've been a bystander, but the bystander is usually like, gotta catch a bus, got lunch, I'll see you later. So how could you, when there's a bystander, both protect the recipient and help the source of the microaggression respond in a positive relationship building way? So here are the researchers. I collaborated with some of my partners at Yale University. You might recognize this individual. I don't have a pointer. So Darren Lattimore was formerly the Associate Dean for the Office of Student and Resident Diversity. We've done a previous study together. And when he moved over to Yale, we thought this is the perfect opportunity for us to do a multi-institutional study, which is what we did. And then we partnered with Dr. Doan Boatwright, who created a survey that correlates student satisfaction and wellness with rate of microaggressions, and I'll show you some of that data. And then Dr. Rosana Gonzalez-Calasso, she spends a lot of time with folks in the PA area, so she was able to help us have another perspective. So some disclosures, we got funding from HRSA. HRSA was happy to do this, but they want you to know that they don't necessarily agree with, or what do they say, does not necessarily represent the official views of nor an endorsement of HRSA. So that's like the disclosure piece. So microaggressions, what are microaggressions? So just simply stated, they're the subtle statements and behaviors that unconsciously communicate denigrating messages to people of color. Now, I just want you to know that microaggressions can happen across identities. This is simply for the purposes of this study, we focused on race and ethnicity. So there can be micro assaults, which Daryl Wing Sue talks about as intentionally and explicitly derogatory verbal or nonverbal attacks. These often come in the form of jokes that aren't really that funny. The micro insults are the rude and insensitive subtle put downs of somebody's racial heritage or identity. And then the micro invalidations are remarks that diminish, dismiss, or negate the realities and histories of people of color. We often hear this in statements like, well, what's the big deal? This is a post-racial society, right? Why are people of color still hanging on to things that happened oh so long ago? If you have time that you're trying to fill and you want another book to read, here's everything that you ever wanted to know about microaggressions. So it's important to know that microaggressions are not always consciously done. And in fact, I often say that they're the outputs of unconscious bias. They're powerful because they're subtle and sometimes invisible to the person who's the source of the microaggressions. And so some of the responses from the perpetrators of the source are, you're being too sensitive, right? I didn't mean it that way, you're being too sensitive, kind of thing. And for the recipient, you're often thinking, what just happened there? Like oftentimes a microaggression comes in the form of what might seem like a compliment. One of the ones I've gotten as a nurse is, wow, Piri, you're so smart. How come you didn't become a doctor? Right? So it seems like that's a compliment. And yeah, great, I'm happy that you think I'm smart, but you just wiped out my entire profession, right? So that would be an example of a microaggression. Why is it important? They cause mental health effects. So Daryl Wing Sue has a significant amount of research that links microaggressions to anxiety and depression. And we also have some data that will back that up. We know about the stress response. So if you're experiencing microaggressions every day, that's a buildup of stress. And we know that stress has an impact on our cardiovascular system. It is related to diabetes, obesity, chronic illness. They perpetuate stereotypes. Okay, and again, they often come in the form of jokes, which you're not exactly sure how to approach them. They passively allow society to devalue groups. They cause lower work productivity. So think about all of the energy that you might have to spend being vigilant and trying to make decisions about how to respond in any given situation. That's taking cognitive energy away from learning and producing, and it's spent on worry and anxiety. And then in the long term, it creates inequities in education, employment, and healthcare. So we wanted to do more, we wanted to find out more, and we wanted to see how this existed in health professions. So we took a mixed methods approach. You'll see we did a quantitative and a qualitative piece. Usually I like to do quantitative to talk about prevalence, frequency, and then the qualitative gives us those deep dive examples. So the data that you'll be looking at is the sample size of 832 students who were recruited through SNMA, and this is through a study that Dr. Boatwright PI'd. We also, the 222, that was data that we got from participants at UC Davis specifically. So the 133 is medical students, and that represents about 25%, which is a pretty good response rate. 58 nursing students and 31 PA. So when we looked at the data, it pretty much mirrored the national data, and I haven't been using that data because the power is so small with it. With the qualitative, there were 37 participants in that. I can't remember the exact numbers. There were slightly more medical students than nursing students, and we only got a spattering of PA students. So the survey was adapted from the racial and ethnic minorities scale and the institutional betrayal scale. And we used just standard frequency logistic regression model. With the qualitative, we did interviews and focus groups. The reason I used two different methodologies was that we have students that are deeply private and want to do it, just one-on-one and don't want anybody else. There's also students that want to be with a group of folks that can support them and back them up. So my approach has been like, whatever students want to do, whatever makes them more comfortable, I'm willing to accommodate. We used in vivo and thematic analysis to find themes. So for the survey, we wanted to see what the relationship between microaggressions and student wellness, microaggressions and medical school satisfaction. So some examples of the survey items were people are surprised by how well I speak English. People mistake me for someone else who shares an aspect of my identity. People imply I was admitted to medical school for reasons other than academic merit. The classic is they just admitted you to fill a quota. And faculty have discouraged me from pursuing an aspect of the medical field that interests me. Oh, I think you'd be better as, and it seems like usually the answer is primary care, right? You don't want to go into surgery, you want to do primary care. So this is what the frequency is. Am I not getting enough volume? Can you hear me better now? Ooh, I can hear me better now. All right. So this is frequency. So as you can see, they're skewing to the right with the majority of students experiencing microaggressions every day. Then there are folks that experience it once a week, and we were calling that high frequency, and monthly to never we called low frequency, and that distinction will make sense in a few minutes. We asked people what aspect of their identity was microaggressed, and this was pretty interesting. Gender a little bit more than race. We were surprised by that, but maybe neck and neck. And what's interesting to me is not that the other ones received microaggressions less, but really the variety of identities where people can experience microaggressions. One of the one that's near and dear to my heart is height. I'm 2 inches taller than my husband, and I like to wear heels, 3 inches, right? And so I've actually had people say, why would you marry somebody that's shorter than you? The only answer I have is, because I love him. You know, like, what do you do with that? But so things like that can impact somebody's experience on the daily. So let's look at wellness for a moment. This to me is a really impactful, I mean, this is like the classic dose rate relationship. So this is essentially telling us that the more you experience microaggressions, the higher risk you are for having symptoms of depression. And this is pretty much known in the literature, but this is also true with our medical students. So then we looked at medical school satisfaction, and there's that high frequency and low frequency piece that I was telling you about. So I would recommend my medical school to friends. Okay, so if you were receiving more microaggressions, you're less likely to recommend your medical school to friends. I would consider my institution for residency, same thing. I would donate money to my medical school. This one is powerful. I have chosen to miss classes during medical school. High exposure, high likelihood that students are going to be missing classes. That makes sense. If you feel like you're going to be in an environment where you would experience a microaggression, that's painful. Wouldn't you avoid it? Don't we do everything that we can to avoid injury? So our students are doing that. I've considered medical school transfer. I have considered withdrawing from medical school. And I'm really interested, we're talking about physically withdrawing from school. I want to know more about that idea of cognitive attrition when people are withdrawing cognitively. So the next piece was the qualitative piece. So I want to share with you some of the things that students told us during the focus groups and interviews. We have 3 themes. The first theme is that students felt devalued by microaggressions. Theme 2, students felt that the microaggressions impacted their learning, their academic performance, and personal wellness. And then students had suggestions for what we should be doing to create more inclusive learning environments. Okay, so I don't know if you noticed the nifty little quote boxes. A student said, "I was the only visible minority in our graduating cohort. I stand out very quickly in a classroom full of people who don't look like me. I am the only person of color I can see at the present time. I have found more and more that in whatever space that I occupy, whether it be in class, in clinical, or when I attend conferences, the voice of minorities is missing." Okay, so this went under the sub-theme of underrepresentation and social isolation. Another sub-theme was the concept of being devalued and discounted. This came up over and over. So people would not respond to things that I'd say in the classroom. Even if I said something that someone else had said after me, they would respond to what that person said, even if it was exactly the same thing. They would not acknowledge that I had contributed anything to the discussion. So this came up over and over, that somebody in a group would present an idea and everybody would just sit there and stare at them, and it would be silent and awkward. And then a white student would speak up and everybody'd be like, "Oh, that's a great idea." And they've said the exact same thing, right? I've heard this over and over across research studies. Grades. I mean, I'm thankful that I'm doing great in the program and really good, but there are times where everyone was asking, "Okay, what did you get on the exam?" And people would say like, "Oh, I got an A, I got 92%, or I've got to retake it." Some people say B's, and I didn't even want to mention it, but I was specifically asked, and I would say, "You know, I did get 100% on this exam." And people would not believe it for some reason. They asked, "Are you sure?" "Yep, pretty sure I aced this exam," right? Assumption of inferiority was another sub-theme. I know sometimes in a study group of 4 or 5 of us, I wouldn't get asked a question or be asked, "What did you get for this question? What did you think about this?" I'm not the go-to person. Sometimes this upsets me because I do know the answer and I can't explain it well. I don't understand why other students don't see me as having equal knowledge on this particular topic, which is very frustrating because it makes me not want to participate in the group, even if I feel like if I feel like no one thinks that I'm bringing anything of value. So this is back to that idea of cognitive attrition. The way that students respond to this is they just stop trying to contribute anything and be quiet and just deal with the program. Here's some stuff that happens in surgery. This isn't a focus group. So student A said something and then student B followed up. So the first student said, I think this generally happens if it's someone who is both white and male and there's an exciting new patient, or if there's a surgery, they get it. I won't even get a shot at it. But I don't even know if it's intentional. It's kind of like they assume the other person is more ambitious or wants it more or something, and they will often get it without even having to ask for it. So student B jumped in and said the visibility factor, it's like there's this thing of being both invisible for opportunities and a high visibility as a person of color. You know, you're passed up for opportunities a lot, and at the same time, there's a magnifying lens over you, watching you for everything that you do. So there's this perception that if I do the slightest little thing, I'm gonna get in trouble for it. People always notice my mistakes, but don't notice me when it's time for an exciting new case. So this is something that came up a lot, particularly at UC Davis. This concept of teaching biological inferiority. And this has been really intriguing to me personally, because this is part of how I got interested in this topic, was, you know, when we would talk about risk factors for cardiovascular disease and diabetes, it was always like, well, being Black, being Latinx, being Native American, you raise your hand, you ask why, and the response is, well, there's a genetic predisposition. And if there's a genetic predisposition, doesn't that imply that there's something wrong with people of color, that there's this biological inferiority piece? So students were talking about this. This mattered to them. One student said, there are microaggressions like lecture. Maybe they'll talk about a disease, and the next thing they'll say is ethnicities with the highest incidence. And I'm thinking, wow, I'll be the one to ask, so what is it about this ethnicity that makes them that way? And they point to genetics. And I'm like, well, we're 99.9 like percent something alike. So is it genetics that's making the change? And then that's when me and the lecturer are at a standstill. Like, okay, the teacher then says, it's not genetics, but I don't really know the reason, so let's move on. So it's just kind of glossed over. And just as a little aside, I think it's kind of funny how many of the likes I redacted from these quotes. Seriously, with this one, maybe 10. I think it's just a placeholder for an but I did redact some of the likes. Another student said, for example, one lecture we had last year, we were discussing like iron deficiency, and he said, patients for most of these people that have this deficiency have kinky hair. And that's like the marker of disease. And I was just like, I think there's a whole population of people that have kinky hair naturally. So to use that as a marker kind of rubbed me the wrong way and kind of made me think, right? So then the next thing is I used in vivo to do a word frequency inquiry. And I was looking specifically at feelings related to receiving a microaggression. And this is the word cloud that I got. I don't know if you know how word clouds work, but the bigger the word, the more frequently it was hit. So, you know, people felt angry, people felt doubt, bad, frustration, triggered, upset. And then the words that are pretty small, some of them only had, you know, maybe 1 or 2 hits, but it shows you the wide variety of pretty much negative experiences related to microaggressions. So we're on theme 2, which is the impact of microaggressions. And so one of the sub-themes was stress and anxiety. And a student says, I mean, for me, I've had to go on anxiety meds and for depression as well, because of like the stress that we go through having to go to therapy, when I never like had to go to that before getting into names the school. So I feel, I don't know if it's a consequence of health profession school in itself, and like the microaggressions and like being anxious. And another student says, you're performing and you're always stressed. How are you going to learn? Yeah, and like that's not the ideal way to learn. Like I'm a curious person. I enjoyed learning at one point, you know, but when you're learning and you're feeling like you're already expected to fail, that's not a good feeling. Okay. The other thing was the idea of divesting in discourse, and this goes back to this thing I've been calling cognitive attrition, this sort of silencing piece. So someone says, yes, it has had an impact on me academically. In the past, if I had questions, I would have just raised my hand. I wouldn't have thought twice about it, and I would have sought out the answer. Now I think twice. In fact, every day before I go to school, I look at this thing I wrote for myself that says, please the teacher, melt into the metal, stay silent. I try to look at that and read that every day before I leave the house to remind myself to keep my head down and keep my mouth shut and not draw attention to myself. Have you heard the concept of the diversity tax, minority tax? Some people call it the brown tax. So the idea with the diversity tax is that a lot of us are doing the general work that's expected in an academic medical school. But for those of us that are of color, we're off. For me, it's search committees. For a while there, I swear I was on every single search committee that occurred in the School of Nursing and the School of Medicine. And in many ways, that's a good thing because they want to have a representative search committee. Yet all the time I'm spending on a search committee is time that I'm not doing research and scholarship. So then folks that are not doing that have that time and they're getting promoted quicker than other folks, right? And there's a fairness and equity issue with that. So the way students experience this is the thought has come up for me a lot. What are all of the other ways that students of color are being pulled away from their studies, not just, because of psychologically and anxiety, but we are the ones who respond whenever something happens. We show up. So examples of this are when there's a shooting, right? Stephon Clark. Students feel that it is their obligation as members of a medical school and perhaps members of an underrepresented group to show up and make sure that people know that they feel that this is unacceptable, right? So every moment that you're doing that is a moment that you're not studying. Another student says, I feel like I've had to be a student and advocate for myself when I should have just been focusing on studying. And I feel like that's been the hardest, where I often feel like I just want to study, but I don't have time to study because I'm going to all these meetings about things that are going on and things that are wrong and things that I want to change, organize for ourselves that the school is not doing for us. So the next theme had to do with what students suggested in terms of strategies. So students were very aware of the lack of diversity in their schools. And they wanted to see more students that look like them, more faculty, more staff, and they emphasized leadership, that we really need to have people in leadership positions who understand, who have experienced what it's like to be underrepresented. Curriculum reform, less focus on race as the basis for health issues, focus on social determinants of health, and structural competency to promote health equity. So one student says, we kind of missed the core of what we're talking about, and we're really talking about racism. And I think we should get back to having those really real, uncomfortable conversations. I feel like, names university, we are uncomfortable with having uncomfortable conversations. So related to that, students wanted to have open conversations. And they recommended professional development of faculty so that they are both more knowledgeable about issues of race and ethnicity and more skilled at facilitating the conversations around race and ethnicity. Students have a perception that faculty don't value diversity, and then when difficult issues come up, they have no idea how to facilitate it. If there's an issue that, somebody says something inappropriate in the classroom, the tendency for faculty is like, oh gosh, that was uncomfortable. Let's switch the slide and go to the next topic, right? So students want to have this addressed, and they expect faculty to be skilled at this and have the ability to go there on these issues. So referring to diversity and unconscious bias workshops, and the people who won't show up are the ones that need it the most. So we must begin to make it something that they have to go to or else they won't. So from my perspective, doing a lot of faculty development, faculty are a difficult bunch to teach. And there's this issue that happens when it's optional. The folks that tend to be in the class are the choir. You usually don't have to convince folks. And the folks that could really benefit from it are choosing not to come. But as soon as you make it mandatory, like a mandatory class that we have right now is anybody who serves on a search committee has to do unconscious bias training. And the vibe there is completely different. I mean, I have people that are seriously angry about being at the unconscious bias training. And, you know, talk about microaggressions, the eye rolling and the this and the that. And, you know, I had one guy that was like making a big show about he's sleeping through the thing. I'm like, oh, come on, right? So, but it's interesting because, I mean, I kind of feel like that when I have to do HIPAA training, right? Like, are you serious? The cyber training, it's already been a year. So there's something that happens with that mandatory piece that is less engaging. And honestly, I'm not quite sure how to remedy that. Safe spaces. So in addition to open conversations, students want to have spaces where they can just be real and sit back and feel like they're with people that understand them. And one of the things that occurred to me about this was, I don't know if you've been on the main campus, but there are student commons. And I happened to be walking by, I looked in there, and they're like couches that look like maybe couches that you get from a thrift store with some old, well-loved blanket hanging over it. And the room was absolutely packed with students. I mean, everybody was sitting on every space in there. There was a lot of conversation happening. And people were smiling. They loved that space. And I personally would love to see a space like that here on our campus. This is a picture. I don't know if you recognize people. I'm in the back. I'm still looking for those glasses. I really miss them and I need them to see. There's Dr. Jan Marie Garcia. And in the middle in the gray shirt, that's Melanie Turvalon. So if you're familiar with Jan Marie Garcia, the two of them coined the term cultural humility in 1998. So we're at a cultural humility train the trainer class. And what ended up happening, you'll see that there's something in common. We're all women of color, and it became this safe space. Like we were doing some training, but we were also debriefing about some of our own experiences without having to like prove that we were experiencing these things. And it was a really safe, lovely environment. And so a student said, and I think we need more of that, just spaces where we can come together in formal and informal settings, right? So the schools can support that. We can do both formal and informal. So these are some of the things that, that we as the researchers have come up with, and I'm also working with the School of Medicine Learning Climate Committee. So we came up with some additional recommendations. So one is set the tone for inclusive climates. So we should have clear expectations. A lot of times expectations are expressed through a mission statement or from a vision. We often talk about principles of community here. We need to promote a safe, collaborative, and mutual environment where feedback can be given and received and personal growth can occur. So one of the things I like to do, I mean, we talked about this earlier when we started, that we are sometimes the recipient and sometimes we're the source. And the times when I've been the source, it's really embarrassing, especially as somebody that, you know, I think of myself as being committed to social justice. So when I drop a microaggression and somebody calls me on it, I mean, I kind of feel like this tingly feeling in my hands, and I'm ever so grateful to the folks who have gently guided me to, you know, what was one of the things I said? Victims of HIV. So I was corrected and said, you know, a lot of people that have HIV don't want to be thought of as victims. Why don't you think about using the term people living with HIV? Thank you. That was very helpful. I had no idea. I just didn't think it through. But as soon as they said it in that way, I was able to hear it and change my practice around it. Be consistent in holding up expectations in the classroom. So there is a time when we need to address what happened, be firm, and then move on. And then role model it. You know, our students are looking at the things that we're doing as providers and faculty. For those of you that are students, you probably know this already and know that people that are coming up behind you are looking at you to model. And we also have robust data in both schools of nursing and schools of medicine that, we teach all of these ideals. You'll hear it in the team peace or health equity courses here at the School of Medicine. We talk about all of these ideals. Something happens in medical school between year 2 and year 3 where attitudes change. And this is like where the rubber hits the road, where people are getting out into the clinic. And what they're doing is they're seeing what the culture of the clinic is, disregarding all the ideals from the early stages and adopting an attitude that is sometimes not all that great. There are things like pimping that Skeeter helped me learn about a few years ago. What did you made up a meaning for it. He's an expert at pimping. I don't believe it for a second. You said that it was put in my place. That was, we didn't know for sure if that was the thing, but that was kind of like a good example of what that means. So that process of pimping is, every time that happens, that's a microaggression. That's like the Socratic method gone terribly, terribly wrong. That questioning process, that's what Socrates did. But he was doing it to evoke thinking, not to prove people wrong. If you're being proved wrong in the middle of a group of people, your frontal lobe goes bye-bye and you're all down here. And this is not where, in the amygdala, this is not where learning occurs, right? School of Nursing, same thing. We have this reputation for eating our young. That's awful. We've got to fix that. So we talk about all these ideals in nursing school. Students get out, they're practicing for 6 months, and they've given up all the ideals that we taught in nursing school and are engaging in some of those behaviors. So we need to show that it can be different. Allyship. So allyship is, moving allyship to activism is about looking for ways that you as a person in a privileged position can truly uplift the voices of those who are often out on the front lines of change. This is a photo. I don't know who's familiar with West Sacramento, but every year there's this field, and on 9/11, they put up all of these American flags. It's a really beautiful memorial. So I took this picture when they put these up after the Orlando shooting. And so they had the American flag interspersed with the rainbow flag as a remembrance to, as an honoring for the LGBT community. And that, I have chills just thinking about it. That's an example of allyship. And so again, we can often think about those identities that we have where we experience microaggressions, but all of us have areas of privilege. The fact that you're in this room means that you have a certain amount of privilege, right? You get to be at a world-class academic center. So that's privilege. But it may be that you are straight rather than gay. Maybe it's that you, I don't know what some of the other, you're more affluent. Maybe you're smarter than, I don't know. But leverage those places. Speak up for folks that that may be exhausted from having to explain all the time. Let me give you another example. Anybody know who Janet Mock is? Janet Mock, anyone? So she is a woman of Black and Hawaiian descent who is also transgender. And she wrote a beautiful book about what it was like being a transgender child, coming out. And so she came and she spoke at UC Davis last February. And she said, I'm tired. I'm tired of explaining to everybody what the transgender experiences are, what the disparities are. I would really love it if other folks could step up to the plate. And I was like, you know what? I can step up to the plate. I can't claim that I have that exact experience, but I've leaned in and tried to learn a lot more about the trans community. So I feel like as an ally, I can do some of that work, right? Some of the organizational strategies that we can do, the school should be doing regular climate surveys. We should have the trainings. Are they mandatory or they're not? I'm not sure. Clear reporting mechanisms are important, but I'm going to say that we should only have clear reporting mechanisms if there's going to be accountability and consequences for the frequent offenders. I think a lot of times these things are reported and we look at them and we're like, well, they have tenure, or they're just going to deny that that happened, so we don't do anything about it. We collect the data and don't have action around it. And I think that's something that we, and I'm using we with a capital W. I'm not pointing the finger necessarily at UC Davis or any institution, but we as the broad we. And considering saying something specific, like there's an actual anti-racist framework that says that not only do we embody the values of anti-racism, but our organization is going to be active in mitigating racism in our organization. We're not going to tolerate racism in any form. So conclusion, supporting students by mitigating and ameliorating racial microaggressions can create inclusive learning environments which not only help underrepresented minority students survive health profession schools, but thrive and reach their full academic potential. This is one of my nursing students, and she volunteered to this child, although she looks pretty young, she's in middle school. And she was talking about the value of being a nurse and was teaching her how to listen to lung sounds. So I think that that's a beautiful photo. So some of the individual strategies that we can do: recognize your own bias. This is a hard thing to do. We have a perception that if we have bias, we're bad people. And if we don't have bias, we're good people. This is binary. But you can be a good person and have unconscious bias. Where you might run into a little bit of problem maintaining this idea of being good is if you just deny that you have them and you keep repeating the same errors, the same microaggressions over and over, you're not doing the development that you should. Ask for and listen to feedback. Have you heard the correlation between unconscious bias and flossing? So think about flossing, something that you should probably be doing every day. You may or may not be doing it. Sometimes you get in there and you find some stuff that you really wish you hadn't found, right? And what do you do with that? You hopefully get rid of it. Same thing with unconscious bias. You should be doing it frequently. You're sometimes going to find things that you wish you hadn't found. The other thing is that if somebody tells you that you have lettuce in your teeth, don't smile at them and say, no, I don't, right? You listen to that feedback and go do something about it, right? So if you're getting the feedback, if somebody has had the courage to give you some feedback, you should listen to that feedback. That took a lot of effort for somebody to have the courage to do that. I sometimes don't have the courage to tell people they have lettuce in their teeth, right? So if somebody's taken the time to tell you, you should listen to it. Is that hand going up? Yeah. Yeah. Mm-hmm. Yeah. It's real. It may not be real from you, but it's real. Mm-hmm. Straight, yeah, yeah. Uh-huh, yeah. The curvy. Yeah. Right, yeah. Mm-hmm. Yeah, so this is terminology. Yeah, no, so I agree. And I have a different relationship with the word straight. I don't know if you are familiar with Humboldt County, Northern California. We are known for the pot industry. This is my heritage. And what straight people were when I was growing up were people that didn't smoke pot. and we talked about straight as a very negative thing, right? So I'm like, how do gay people get the word straight? But it's the verbiage that's used by the LGBTQ community, and I have chosen to use that word because that's what the community has asked. I have been told by folks from the LGBT community that the word homosexual feels very offensive. I was using that word for a while, and that sounds very clinical and diminishing for folks. So they've said that the terms that we prefer are straight and gay. I'm like, okay, you tell me that, I'm going to use it. I hate it when I accidentally say homosexual or something different, but I'm listening to what the community is asking. And I also want you to know that language evolves over time. You know, like on my birth certificate, there's the word Negro for my heritage, right? We don't use the word Negro anymore. That was fine back in 1970, but we're not really using that, and that's changed. Some of the older folks in my family will use the word Oriental. That was commonly used. We're not using that term anymore. So it may be that you learn the term and then you have to relearn it, right? LGBT is used a lot now as a more neutral phrase. Yeah. So we just have to listen and be willing to learn and willing to be wrong and, you know, have to change it in different environments. In terms of your question about feedback, I mean, there are multiple mechanisms. There's a huge power dynamic. So a student is very unlikely to tell you to your face. And students are paranoid that they're like, you know, you can get your credit card hacked. So how do I know that my evaluations aren't being hacked? So a lot of people won't be forthright in the evaluations. I see nodding out of the corner of my eye. Several students have said that. I think that a place that you might be able to get better feedback is through peer evaluation, asking your colleagues, particularly colleagues from a different identity than you, to come and observe your teaching. At the previous place I worked, that was the requirement, is that you had a certain amount of folks come in and do peer evaluation. So I think that you're more likely to get feedback there. It may be that you're getting that feedback outside of the academic setting from the community. And I've had people come up and say, you know, a student said this to me, what should I have said, right? A faculty member came up to me and told me that her student, who was of East Indian descent, often gets confused as being a Mexican student. And the faculty's like, I didn't know what to say, so I didn't say anything, and now I'm feeling like, so she came to somebody else that had a little bit more knowledge about racial interaction, and I was able to give her some feedback on that. The other thing that we tend to do is, yeah, go ahead, Erin. I think I just have like 1 or 2 slides and we'll go to the general question. Try not to defend. Oftentimes when you get the feedback and somebody calls you out, you're like, but that's not what I meant. That's not what I intended. And this is this is a perfect time to make it not about you. It doesn't really matter what you intended. What matters in this moment is the impact and the opportunity for you to learn and engage. And maybe you're not learning, you generally didn't intend that, but you can practice the art of apologizing, right? And the apology is huge. You acknowledge the person's feelings. And a way that you might say this is, although that was not my intent, I see now how what I said or did impacted you, and I'm sorry. It's not really that hard to do. And then you can engage in a conversation like, tell me more about how that impacted you. What could I do differently so that I don't do that to the next person? And that's the opportunity for a dialogue. Here's a long summary. Rhetorical question for you. You don't have to answer this, but how will you contribute as an individual and collectively to live up to our mission and values of diversity and inclusion? I think we should be asking ourselves that. Another thing about allyship, the greatest thing that an ally can do as a form of activism is building their own capacity to receive criticism, specifically when said criticism is coming from marginalized people on your campus. So I'm going to point out that I just gave you a lot of data from marginalized people from our campus. And so the question is, what are we going to do with that information? Erin.